Contraceptive methods are tools and techniques used to prevent pregnancy. They vary in their effectiveness, convenience, side effects, and whether they provide protection against sexually transmitted infections, STIs. Contraceptive methods can be broadly categorized into several types. 1. Barrier methods. These methods physically block sperm from reaching the egg. Male condom. 1. A sheath worn over the penis during intercourse. 2. Protects against STIs as well as pregnancy. 3. Made from latex, polyurethane, or lambskin. Lambskin does not protect against STIs. Female condom. 1. A pouch inserted into the vagina before intercourse. 2. Provides some protection against STIs. 3. Made of polyurethane or nitrile. Diaphragm. 1. A shallow, dome-shaped cup inserted into the vagina to cover the cervix. 2. Used with spermicide to increase effectiveness. 3. Must be fitted by a healthcare provider. Cervical cap. 1. Similar to the diaphragm but smaller. 2. Also used with spermicide and fitted by a healthcare provider. Spermicides. 1. Chemicals that immobilize or kill sperm, available as creams, gels, foams, films, or suppositories. 2. Often used with other barrier methods for added effectiveness. 2. Hormonal methods. These methods use hormones to prevent ovulation, thicken cervical mucus, or thin the uterine lining to prevent pregnancy. Combined oral contraceptives. The pill. 1. Contains estrogen and progestin. 2. Taken daily to prevent ovulation. 3. May have additional health benefits, like reduced risk of certain cancers, but does not protect against STIs. Progestin-only pill, mini pill. 1. Contains only progestin. 2. Taken daily and is suitable for women who cannot use estrogen. 3. Less effective than combined pills and must be taken at the same time every day. Contraceptive patch. 1. A small patch that releases hormones through the skin. 2. Worn on the skin for 1 week at a time for 3 weeks, followed by a patch-free week. Vaginal ring, NuvaRing. 1. A flexible ring inserted into the vagina that releases hormones. 2. Worn for 3 weeks and removed for 1 week. Injectable contraceptives, Depo-Provera. 1. An injection of progestin given every 3 months. 2. Highly effective but can cause side effects like weight gain and bone density loss. Implant, Nexplanon. 1. A small, flexible rod inserted under the skin of the upper arm that releases progestin. 2. Effective for up to 3 years. 3. Intrauterine devices, IUDs. IUDs are small, T-shaped devices inserted into the uterus to prevent pregnancy. Copper IUD, Paragard. 1. Non-hormonal, uses copper to prevent sperm from fertilizing an egg. 2. Effective for up to 10-12 years. 3. Can cause heavier menstrual bleeding and cramping. Hormonal IUD, Mirena, Skylar, Liletta, Kylina. 1. Releases progestin to prevent pregnancy. 2. Effective for 3-7 years depending on the type. 3. Can reduce menstrual bleeding and cramping. 4. Emergency contraception. Emergency contraception is used to prevent pregnancy after unprotected sex or contraceptive failure. Emergency contraceptive pills, ECPs. 1. Also known as the morning after pill. 2. Most effective when taken as soon as possible after unprotected sex. 3. 2 types, levonorgestrel, Plan B 1-step, and olipristal acetate, ELA. Copper IUD. 1. Can be used as emergency contraception if inserted within 5 days of unprotected sex. 2. Also provides ongoing contraception for up to 12 years. 5. Permanent methods. These methods provide permanent contraception through surgical procedures. Tubal ligation, female sterilization. 1. Involves cutting, sealing, or tying the fallopian tubes to prevent eggs from reaching the uterus. 2. Highly effective and permanent. Vasectomy, male sterilization. 1. Involves cutting or sealing the vas deferens to prevent sperm from being released during ejaculation. 2. Highly effective and permanent. 6. Fertility awareness methods, FAM. These methods involve tracking the menstrual cycle to determine fertile days and avoiding intercourse or using contraception during those days. 1. Calendar method, tracking the length of menstrual cycles to predict fertile days. 2. Basal body temperature, monitoring body temperature daily to identify the slight rise in temperature that occurs after ovulation. 3. Cervical mucus method, observing changes in cervical mucus to identify fertile days. 4. Symptothermal method, combining several fertility awareness methods for greater accuracy. 7. Withdrawal, pulling out. 1. Involves withdrawing the penis from the vagina before ejaculation. 2. Less effective than other methods due to the risk of pre-ejaculate containing sperm. 8. Lactational amenorrhea method, LAM. 1. Relies on the natural infertility that occurs when a woman is exclusively breastfeeding. 2. Effective only under specific conditions: the baby is less than 6 months old, breastfeeding is exclusive, and the mother has not had her menstrual period return.